at this point, we need to take you to that health briefing just to hear what is being said with regard to the latest development around COVID-19.
On the recording in progress infections and the fifth wave from Professor Moshamshabela, who's the Deputy Vice Chancellor from the University of KwaZulu-Natal, followed by questions and answers. Then the Deputy Minister, Dr. Jomo, will do the wrap-up and closing remarks. Without wasting any time, I'm going to allow the Honorable Minister, Dr. Joe Phaahla, to take to the podium. Over to you, Minister.
Thank you very much, Mr. Mohale. Good morning to everyone on the platform. Morning to Deputy Minister Jomo. Morning to the DG and the team from Department of Health. To our special, guests, the Dr. Wasila Jasad from the NICD, and also Dr. Richard Lessers from the Genomic Sequencing Network, Professor Musa Mushabela from the Deputy Vice Chancellor from the University of KwaZulu-Natal, members of the media, ladies and gentlemen, good morning, Dumelang to all South Africans this morning. It's been quite a while since we shared with South Africans about how the pandemic, the COVID-19 pandemic, is progressing in our country and its impact on our lives. A major focus over the last almost 2 months has been on the exit from the state of disaster as the tool which we have been using in managing the pandemic. Over this period, there's been a sense of stability characterized by low infection rates, a low hospitalization, and also a very low death rates. At the same time, we've been witnessing very low uptake of the vaccination, unfortunately. During this time, the regulatory regime around the containment of COVID-19 dominated the public discourse in as far as COVID-19 is concerned. But at the same time, we continued to warn the public that this was not the time to lower our guards in as far as making sure that we can contain this epidemic or pandemic. And because part of that was that we've been noticing spikes of COVID-19 infections in other parts of the world, especially as many people will be aware, in the People's Republic of China, where there's been lockdowns in big cities such as Shanghai, and also seeing a lot of panic in other big cities such as Beijing and other parts of the world, including South Korea and parts of Europe. We've been seeing huge spikes of COVID-19. So we've been warning that while we're experiencing good stability with low infection rates, that we need to remain on the alert. Over the last 2 weeks, we started to notice a continuous rise in daily infections, led in the main by the provinces of Gauteng, Western Cape, and KwaZulu-Natal. The rise in daily infections took a sharper uptick as we got to the end of just the last week, the week which ended on the 23rd of April. And this uptick has been sustained during the week starting on the Monday of the 25th of April up to yesterday, reaching up to over 6,000 one-day infections on Wednesday, the 27th of April, which reflected on the tests which were done on the 26th of April, that is the Tuesday, just before the holiday. We then witnessed a slight decline to just over 4,000 infections on Thursday, that was yesterday, the 28th April. But we also are aware that this was tests which were done on a public holiday, on Freedom Day on the 27th. So we know that public holidays and weekends, the tests, the referral to the hospitals and also to laboratories for testing is usually lower. So we take this with that kind of reservation. But what was important was that even then, the positivity rate remains quite high in the region of 17%. But in the provinces of Gauteng and KwaZulu-Natal, in the two, the positivity rate was actually above 20%. So we decided to wait a bit longer to observe this trend before we could communicate with the public, just to be able to have at least 14 days of observation to see whether this upward trend was being sustained or whether it was just something which was just for a moment. But the answer to that question is a resounding yes, that indeed over the last 14 days, the rise in infections have been sustained from just going over 2,000, 3,000, 4,000, up to reaching 6,300 in one day, as was the report on the Wednesday, which reflected the Tuesday test. Nationally, as of 25th of April 2022, there has been a 137% increase in new cases compared to 7 days prior, which is, when you look at the infection curve, it's a steep rise. This new steep rise was driven by higher rates of infection, as I've said, in Gauteng, in KZN, and also in the Western Cape. The three provinces, just on a daily basis, including yesterday, accounted for 85% of the positive cases of the country, and it was the same trend over the last 7 days. As of yesterday, when you look at so that is the 7-day average, but as you look even yesterday's result, Gauteng province alone accounted for 53% of the positive cases, KwaZulu-Natal 23%, and Western Cape 11%. So that actually gives you 87% of all the positive cases of the country. The positivity rate also quite worrying. In Gauteng, 23%, KwaZulu-Natal 23%, Western Cape 16%. The only new province which shot up in terms of positivity yesterday was the Northern Cape, which surpassed Western Cape at the rate of 18%. Active cases have risen from the lows of just less than 15,000 active cases in a day some weeks ago to 39,500 active cases yesterday. When we look at the R number, the reproductive rate, the reproductive number, this has also gone now above 1 as of yesterday at 1.56, which again is another pointer that we are indeed on the rise. The highest incidence per 100,000 of population is also in Gauteng at 76 per 100,000 population, followed by KwaZulu-Natal at 47 per 100,000 population, and the Western Cape at 46 per 100,000 population. So all these numbers point to a very steep rise in the rate of infection. So in terms of the rapid rise of infection, we can say that over the last 14 days, there's indeed no doubt about it. But what remains stable, even though with some changes, is the hospital admissions, including ICUs. Not a very dramatic change, but it has been noticed that there's been some change, which I'll come to the numbers. As of yesterday, the total admissions were again just over 2,000. Just 2,027, and those in ICU 192. So, but in absolute numbers, we have also seen some increase in admissions. For the week of April 18 to 24, there was an increase in admissions from the previous 7 days of 346 people admitted in the previous week. But on the week of the 18 to 24, this was more than double, at 808 people who were admitted in hospitals. Not yet very much threatening to the health capacity, the health services capacity, but indeed a trend which shows that there is definitely, as the numbers rise, also the number of admissions, although not at the same pace, also rising. But we also know from previous experiences that admissions and deaths are always trailing the high rise of infection. There was also a rise in death, not very dramatic, from a low base of a previous 7 days where there were only 51 deaths to the week of, again, the 18th to 24th of April, with almost a triple number of 156 deaths for that week. The question which is now on top of our minds is whether we have entered the fifth wave as much earlier than we expected, because all along we've been expecting, as advised from our scientists, that probably middle of May or later in May or even early in June, we may enter the fifth wave. The question now on the top of our minds is whether, and as it's been debated in a number of media platforms, is whether indeed this fifth wave has commenced. Just amongst those who have been commenting on this, it's Professor Salim Abdul Karim, the previous chair of the Ministerial Advisory Committee, who issues a weekly email report in terms of his observation. And in this week, Tuesday, in his analysis, he argues that from a technical definition of more than 5 cases on a daily basis per 100,000 of population, with that as a criteria, he believes that we have entered the fifth wave, that in most of the provinces we have entered the fifth wave. But from another kind of a characterization of whether we are in the fifth wave, it is argued that we can only say that we are in the fifth wave if there is a sustained more than 6,237 cases per day on average over a sustained 7-day period. That will then tell us that we are indeed in the fifth wave. But whichever way you look at it, even from this kind of definition, as I've already alluded to on the Wednesday, the 27th, when we're reporting on the cases reported of the laboratory test of 26th April, we're already above 6,300. And there's just a dip from yesterday's report, which reflected tests done on the holiday. So whichever way we look at it, it does suggest that we may actually be entering the fifth wave much earlier, and we will possibly, we have to just wait for a few more days, maybe another 7 days, to can be very sure that this was not just a sporadic uptick, but it is a sustained uptick. What is also uncertain is, from our scientists, is whether, because we have always been informed also that when the new wave comes, it will be driven by a new variant. But at this stage, we have not been alerted to a definite new variant except changes in the Omicron, which is now just the subvariant of the Omicron. So our scientists have been saying to us that a new wave will be driven by a new variant, which will be more transmissible and which will escape immunity. But at this stage, the variants which have been confirmed are the subvariants of Omicron, currently dominating being the B4 and the B5, which have some changes compared to the original B1, but not enough to be defined as variants of concern. Because we are told that the changes are not that significant, and they still bear the hallmark of the original Omicron. So this is also a question mark which we have to observe, and we'll listen. I'm sure Dr. Lassen will tell us more about this from the genomic sequencing. While these are the scientific analysis which the NICD and our colleagues from CRISP and the network will say more about, what is clear is that we are still at great risk of the COVID-19, especially as we go into a very long winter, as we can all see that we are just at the end of April, but we have already entered the winter. So it's going to be a very long winter where more people spend more time indoors, and where even our gatherings, whether for functions or even just for restaurants and other activities, will largely be indoors, which with the risk of high spread of any respiratory infection. Because of the lack of clear driver of the spiking infections, there is also an analysis that because of the Easter weekend, which also coincided this time with the holy period of Ramadan for Muslims, and also the Passover for the Jewish faith, that there were a lot of religious gatherings, which also could have been the trigger for the spike which we have seen over the last 14 days, because this is also coinciding with just the 14 days after the Good Friday and the Easter long weekend. So the next 7 days until the 6th of May will give a clearer picture as to where we are going. That is, whether the fifth wave has started earlier without any distinct new variant, except for the sub-variant, whether the sub-variants will be the ones driving the early entry into the fifth wave, or whether it's simply gatherings as a result of the Easter weekend, as I've already alluded. Our message, notwithstanding this kind of uncertainty and further observation, but as we'll hear from the experts on the platform, our message again remains to say that COVID-19 remains a threat. It's not over, and we cannot afford to drop all the prevention measures. We do not believe that it is correct public health approach to say that because there is a lot of immunity, that is natural immunity and vaccine-driven immunity, we must just let the virus spread. We don't believe that this is the correct approach, because this will cause a lot of illness and a lot of distress amongst the people, individuals and families and community at workplaces. But also it will still have a very serious pressure on our health facilities and our health workers who have borne the brunt of this pandemic. We again urge all those who have still not vaccinated to come forward and take the jab. We are still under 50% of the adults who have taken at least one dose of the vaccination. We have been stuck at just under 50% in terms of the average of those who have taken at least one jab. And we need to get this at least up to 60% to protect us as we go into this very long winter. We especially urge our young people, those between the ages of 18 and 35, to come forward in numbers, because you need to protect yourselves and also protect the older people around you. We know that natural immunity wanes with time, and it cannot be boosted. It is only the vaccine-initiated immunity which can be boosted from time to time. And on this note, we also urge all those who have taken vaccinations, who are eligible for boosters, to please come forward and take their boosters. Lastly, in terms of the health regulations which we published, the commentary period has come to an end on the 24th of April. So now we are busy assessing these comments. We have received well over 300,000 comments, and we are taking all of those seriously. We are studying those, and once we have concluded, which we have to do before the 5th of May, when the disaster recovery regulations come to an end, we will then be able to announce on the regulations which we will promulgate. Thank you very much, Mr. Mohale, and over to you and the rest of the panel. Thank you.
Thanks very much, Honorable Minister, for that update. Indeed, the lifting of the national state of disaster does not mean COVID-19 is over. So without wasting any time, I'm going to call upon Dr. Wasila Yasat from the NICD to give us the epidemiology report of the COVID-19. Over to you, Prof. Doc.
Thank you so much, and good morning to the Honourable Minister and all the guests and the participants today. I'll be presenting on behalf of my colleague, Dr. Michelle Groom, and others at the NICD, combining both the epidemiology and the hospitalization update of this latest COVID-19 resurgence.